fishing. Well, maybe we can handle that too. Wrist stuff. Elbow stuff. Okay, yes, let's learn some adjustments. So, posterior radial head. So again, so when people have tennis elbow, there is a tendency to pull the radial head in the posterior direction. So we're going to test it by pushing it in an anterior direction to see if there's springiness at the end of the movement. We want to be careful. We're not testing this motion here, and we're not adjusting this motion here. We're not going to hyperextend the elbow in this process. We're just going to push here. So there's a couple ways of doing this. One thing is I'm going to have my fingers on the medial elbow and my thumb on the posterior aspect of the radial head. So when I do this, I'll be pushing the radial head from a P to A direction. The other thing I'm going to do, just like we've done in other situations, is I'm going to test the patient in supination, in pronation, and I'm going to test the patient in supination. And so I'm going to supinate the forearm and push from P to A and feel for springiness. And I'm going to pronate the forearm and push from P to A and feel for springiness. Now I'm not holding the wrist when I'm doing this, I'm holding the forearm. I don't want to be affecting the wrist bone in this process. I'm also not going to bring the elbow to full extension. I'm going to avoid that. And the other aspect of this, and if you look at this carefully, the radial ulnar joint doesn't run perfectly like this, but it kind of angles this way a little bit. So my stress and thrust when I do this is going to be from P to A and a little bit of lateral to medial. And that's what's going to help me be specific. So can I meet you again? So for people to see, we're going to go like this. So what's the first thing I got to do? I got to find the radial head. So then there's two bumps here. It's the distal bump. I want to make sure I'm on the correct bump. So I'm supinating and pronating. I can feel it here. And I want to contact the radial head with a P to A tissue pull. So by doing this, I'm going to be just exactly on the posterior aspect of the radial head with a nice stable tissue pull. I'm going to walk around this way. There you go. And you notice I'm using my fingers here to stabilize the medial forearm. I'm going like this, and I'm testing him, pushing from P to A and a little bit of lateral medial, feeling for springiness and supination, and feeling for springiness and pronation. Now notice something here. I can have him in supination. This right here is movement of the shoulder. It's not movement of the forearm, and this doesn't really matter. I want to do this to have a position that's beneficial to me in my ergonomic situation, because we'll see people going like this and trying to adjust like this. Now, do you think this is ergonomically correct? Probably not, you know? But I can go like this and still have him fully supinated, and this, you know, this is very stable for me, and there's no risk to my body in this process. Similarly with pronation. When I pronate, I can bring him around like this, but what I'm doing is I'm rotating the glenohumeral joint. I don't need to rotate the glenohumeral joint, so I can keep him pronated and still be in a great position for me to perform the thrust. Now, all that we're going to do is we're going to test in full supination and full pronation. But you could find anywhere in between there where you would find that it might be fixated, you might want thrust. Notice also, I'm using all four fingers on this side. I want a nice broad contact on the medial side. I'm not going like this, squeezing the joint. All four fingers are absorbing that force. So I'm going to supinate fully, and I'm feeling for springiness. I'm going to pronate fully, and I'm feeling for springiness. And if there's fixation and supination, I would thrust in supination. So what am I doing here? I'm doing this movement here, kind of like a pre-stress, but my thrust is P to A, lateral medial, and a little bit lateral medial. Or in pronation, same thing. I feel for springiness and thrust from P to A, lateral medial. You with me on this? Let's get the pair.